Today's topic is on primary healthcare. So, what is primary healthcare? So, primary healthcare is essential healthcare and technology based on scientifically sound on acceptable method and technology made universally accessible to individuals and families in the community by means acceptable to them through their full participation and at a cost that the community and country can afford. So, from this definition, it means primary healthcare is that type of healthcare which anybody, anyone in the community can access it and accept it and take its services with free of cost or at a cost that they can afford it. And in primary healthcare services, they can participate or involve in their healthcare services. So from the definition, primary healthcare simply it is a type of healthcare where anybody, anyone from the community can access this care, these health services, can reach these health services facilities, can accept these health services and can take its services with free of cost or at a low cost or at a cost that they can afford this cost of service, and they fully participate in their health services. This is called primary healthcare service or primary healthcare. We see which is acceptable by the community people, accessible by the community people, and affordable by the community people. Can afford those type of healthcare services. They can afford it, and they participate in their health services. So, next come to principles of primary healthcare services. So, first principle is equitable distribution, coverage and accessibility. Next is community participation, intersectoral condition, appropriate health technology, and human resources. So first come to equitable distribution. So what is equitable distribution? From the term you can understand that equitable distribution, equally distributed. From the term we can simplify it, that is equitable means equally, distribution means distributed. So it means that primary healthcare services must be shared equally by all in the people irrespective of their ability to pay, and it covers to urban or rural areas and to any segment of the community, but giving priority to the urban privileged and underserved section of the society. So in equitable distribution it simplifies that these primary healthcare services is equally shared or equally given to irrespective of the people, that they are irrespective of their ability to pay, and it covers rural areas and urban areas, and mainly primary healthcare services mainly focuses on the particular area, a particular community or segment of the community where underprivileged and underserved section of society these primary healthcare services covers. Underprivileged and underserved section of society means who are below poverty line and cannot reach to the services. Backward people, underprivileged people, poverty area, below poverty line, those peoples are the first priority or first focus or first goal is the underprivileged, below poverty line, or the persons who, the community, the sections who can't reach to the primary healthcare services. Next come to coverage and accessibility. The primary healthcare aims at providing essential healthcare to the whole population. It implies providing healthcare services to all which are required by them. The population, it means the population who needs healthcare services urgently and their requirements are provided by the primary healthcare services. Main aim is to fulfill the needs, to fulfill the requirements of the community people regarding health. So as for example, the population who are at risk, the needy population who need first priority, that is children, mother, elder population, adolescents, those are the high risk population or first priority of primary healthcare services. The population are children, mother, elder population, adult. So those are the needy population, those are the risk population. So in coverage and accessibility by the primary healthcare services, those population are first priority or first focuses on those population and fulfilling their needs or requirements. The care was to be appropriate by the primary healthcare services. To the care should be provided appropriate and adequate in content and in amount to satisfy the essential health needs of the people and has to be provided by methods acceptable to them. So by this, the healthcare should be appropriate and adequate in amount that fulfill the needs of the people. So by the care which is provided by the primary healthcare services, the types of healthcare services which is given by the primary healthcare services, those care should be appropriate enough and adequate amount that fulfill the requirements and needs of the population. So next come to community participation. And one more thing in coverage and accessibility, that in accessibility, the primary healthcare services, the services, which types of services are provided by the primary healthcare, the services should be culturally acceptable and financially acceptable. Means the population where we provide the primary healthcare services, the care should be or services should be culturally acceptable and financially acceptable. Next come to community participation. Next principle is community participation. From the term community participation, it is the process by which individual and families assume responsibility for their own health and welfare and for those of the community and develop the capacity to contribute to their and country's development. So in community participation, here the healthcare team in these primary healthcare services, the types of care which is provided by the primary healthcare team, in these care services, all the community people are involved in their healthcare services. As for example, suppose health team planned to provide knowledge regarding hand hygiene or hand washing. So they can involve a community people to demonstrate hand washing steps. Suppose a healthcare team or the team which provide the health services to the community people, they decide or they plan, they educate or they explain how to maintain hand hygiene before eating or in our life activity. So the health team, during her planning, during her actions, they can involve, they can choose the community people, and they instruct the community people how to maintain the steps of hand washing. They choose the community people, they participate, they motivate the community people to demonstrate hand washing steps. The instructions should be given by the health team, but the demonstration is done by a community people. So here community participation, by this way community participation starts. So by this way, there are many ways in which community can participate, or community people can participate in every stage of primary health care. So they can involve in assessment of their health need. By this way they can, in community, by the community participation, by this way they can understand, they can identify their health needs, their problems, they can set their priority, which type of problem should be solved first and which should be next. And after setting priorities, they can planning for alternative actions, and they can implement of those actions in their life, in their life activity or living practices. And after those action, after those implementation of actions, they can evaluate their actions, that the actions are effective or not. So by this way we can participate, we can motivate, we can involve the community people in their health services plan, and by this way community people identify their problems, health problems, they can solve their health problems by themselves. So next is intersectoral condition. So as it declared by Alma conference that the attainment of the highest possible levels of health is a most important worldwide social goal whose realization requires the action of many other social and economic sector in addition to health sectors. So not only the health sector, the other sectors are combinedly act to provide primary health care. So only health sector can't do all aspect of care related to health. So all those sectors are needed to promote health. So not only the health sector can't do all aspect of care related to health. The other sector needed, that is agriculture, housing, water supply, sanitation, PWD, information and education, communication, those sectors combinedly act with the health sector. That's why primary health sector can reach it, the primary health sector can reach its highest level of care. By the intersectoral approach or intersectoral or the combination of those all sectors with the health sector, by this way the primary health sector, primary healthcare can be reached its highest level, can effectively we can provide all the health services when all the sectors combinedly act with the health sector. Next come to the next principle, that is appropriate health technology. It is very important factors for successful primary health care. It implies the use of methods, techniques, equipment which are scientifically sound but simple in accordance to those for whom these are used. As for example, for prevention of anemia or treatment of anemia, nurse educate or advise the person or the patient or client to take iron rich diet. So in diet planning, she should incorporate those diet or foods which is available to that community, to that locality, and the food should be affordable by that particular patient. Means appropriate health technology implies that it may be equipment, it may be methods, it may be anything which is related to health or care, which is provided to the patient or client or community people, should be affordable by them and should be locally available, locally manufactured. That I previously told in example, that a nurse or a health team educate or advise a patient, anemic patient, to take iron rich diet. In iron rich diet, she incorporate the diet plan according to the locally available food or affordable by the patient. Next come to human resources. So it is very important factor for the success of primary healthcare. This resource is not used effectively. If these resources are not used effectively and sufficiently, for effective implementation of primary healthcare, it is very essential to make full use of all the available resources, including the community people, involvement of community people, helping them to develop their competencies to deal with their own problem. So in human resource, it implies that uh, during our primary healthcare planning, we should incorporate, we should successfully, we should effectively and sufficiently, we should use our whole human resources. That's why we can effectively provide primary healthcare services. So it is a very big point to use the sufficient and effective way of human resources. Means the community people, whole involvement of community people in their health planning, helping them to identify their health problems, help them to or motivate them to develop their competencies to deal with their own problems. This is the human resources.